Hey, manual therapy friends, it's Dr. David here. I am bringing you today's Research Review Monday. We're going to cover a study out of Brazil that was published in the Journal of Manipulative and Manual Therapy. And so this is the journal that the AAOMPT, the American Academy of Orthopedic Manual Physical Therapists, puts out. And these are some Brazilians that put this study out. So pretty cool work in Brazil are doing here. Now, the title of the study here is "A Pragmatic Neural Tissue Management Improves Short-Term Pain and Disability in Patients with Sciatica, a Single-Arm Clinical Trial." Now, what they did real basically is they looked at the effect of treatment for sciatica using both neural glides and manual treatment. And I'll go into what they did exactly manual therapy wise, but what they found was that the manual therapy treatment, in addition to the neuro techniques they did, the glides, made a significant difference. So the idea is that you can't just treat the nerve here, you have to treat the nerve and other things that touch the nerve. So we're talking like the bones and the muscles that surround the nerve. Which I'm 100% with. I think that's the way to do this here. What they found here in the results, there were 24 or 28 participants. It wasn't that many. It was 20 something. They saw the therapist for 16 visits over 12 weeks. Their pain scores decreased, their lumbar disability scores decreased, and their disability improved. So that was pretty cool. All right, let me get into what they did. Oh, I love this statement they put out here. The mechanism of sciatica is related to a distortion of the nerve, the effect of the local inflammation, or non-spinal causes. I like that they use the word non-spinal because, and he goes into it here, the sacroiliac joint, the piriformis, and then he talked about the double crush syndrome. Double crush, for those of you that don't know, is talking about nerves. So the nerve being crushed or deformed or distorted, like he said here. But you know, we talk about it a lot with like radiculopathy and how a herniated disc might put pressure on a nerve root. Well, that might be one area of the nerve that is getting crushed. But if you have some muscle somewhere that is spasming or somehow it's putting pressure on the nerve, that's a second crush site, double crush. And I believe you can have multiple crush syndrome, where you have 3 or 4 areas that are putting pressure on the nerve, which may not be enough pressure to cut off the flow of the nerve 100% and create like a complete atrophy of the muscles or just loss of function of the nerve. But it's more like just a little bit of pressure here and here and here and here that ends up causing a lot of pain for the patient and disability. Where they're having to limp around, where they get sciatica essentially, or some other nerve-related problem. But let's get into their methods here. Here it is. So soft tissue mobilization. They did myofascial release technique over the hamstrings and the piriformis, and it even goes into detail about what they did. They found a restricted area, basically like a trigger point, and they just held it there for 90 seconds. Oh, it says their trigger point. They did a hip joint mobilization and cross-friction massage over the sacroiliac joints bilaterally for 15 repetitions with the patient in prone. So they didn't even do any joint manipulations from what I understood in this study. They didn't really deal with the lumbar spine even. They just went straight for the hips and the thighs and the SI joints. That was as close as they got to the lumbar spine. Now, the second thing they did here, I have highlighted in blue, is neural mobilizations. So these are like slide glide techniques for the sciatic nerve. So they did this in combination. And here they said, 44 patients were diagnosed sciatica, and the final sample had 28 patients. There we go. And so in the end, what they found was that it improved. The patients improved all around with getting the manual therapy techniques in combination with the neural glide. Takeaway point for you as a manual therapist or aspiring manual therapist, or even if you're just dipping your toe into this stuff, kind of checking this out for the first time. If you get a sciatica patient, of course you're going to think about the nerves and do something about the nerves. You might do some neural glides. That's kind of the big thing that was pushed out maybe a decade ago. And so it's more prevalent in in the physical therapy outpatient orthopedic setting. But don't underestimate the power of the neuroglides in combination with considering all the potential pressure points of the sciatic nerve. And you just have to listen to the patient, ask the right questions, and you get the right answers out of them. Ask them if they got back pain. Chances are that they've got some spasming muscles back there, joint restrictions in the facets. If they've got hip pain, you got to look at the hip joint, the SI joint. If they're telling you that they feel off or asymmetrical, they might actually have a pelvic dysfunction as well that you can address, an SI joint problem. In other words, the way that they move could be causing some sort of pain. Another knee injury, an old standing knee injury, and if they have some loss of motion or if they just have terrible body mechanics when they move, when their walking form is bad, if they're an athlete and they run with terrible form that happens all the time, they may be not constantly putting pressure on that nerve to create that double crush syndrome, but at times putting pressure on the nerve. The way they sit could be causing pressure on the nerve. A classic example is it tends to happen in women from what I see. I just don't see many men with this problem. But the women that sit with their legs kind of all contorted, and that's how they get comfortable in their chair, you bet they're putting pressure somewhere, somehow on their nerves. So take that into consideration if you can't find anything on the subjective or objective time the first time that you see them. But I love this study. I thought it was great. And what he wrote on here that I've highlighted, to our knowledge, this is the first study to describe the effect of neural tissue mobilization in combination with the treatment of surrounding tissues for the management of sciatica. I think there needs to be more research like this, 100%. And this was done recently, by the way. I didn't mention the year. I think it was in 2017, if I'm not mistaken. It was 2019. There it is. All right, guys. So I hope that this was helpful for you. If you have any questions, comments, just leave them down below. And let's get talking about how you treat sciatica. Do you even treat the surrounding areas? Is that something you've ever considered? Or maybe you don't know how to do it and you're not sure where to start? I'd love to start a discussion on that. I can tell you probably 10 places you can look at. You got to ask patients some questions to narrow it down and prioritize where you're going to look at treating outside the sciatic nerve. But comment here, and I'm happy to help. Have a great day. Bye-bye.